Okay, class, we are continuing on with the second part of digestion, and let's continue on here with the stomach. So we know that the stomach is designed to hold ingested food, and it's going to degrade the food or catabolize it both physically and chemically. We know that we have very strong digestive enzymes. But what do we mean by physically? That's a really important term to understand the mechanics of the stomach. Now, if you remember in lab, the stomach had three different layers of muscle: circular, oblique, and longitudinal. So the stomach can contract, and inside the lumen of the stomach, there are rugae. So the rugae of the stomach aren't designed only to allow expansion of the stomach. They're like folds within the lumen of the stomach. They also kind of act as like secondary teeth. So as the muscles are contracting, it can still mechanically grind and break down the food with the contraction of the muscles. The stomach delivers chyme to the small intestine. Remember, the food starts as bolus in the mouth. By the time it hits the stomach, now it's chyme. The sphincter from the esophagus that opens into the stomach is the cardiac sphincter or lower esophageal sphincter, but then the sphincter that opens up at the lower end of the stomach to dump the contents into the duodenum, the first part of the small intestine, is called a pyloric sphincter. Enzymatically digests proteins with pepsin. We know that pepsin is the active enzyme. It starts off as pepsinogen, and the hydrochloric acid that's produced by the parietal cells activates the pepsinogen into pepsin. Secretes intrinsic factor that's required for the absorption of vitamin B12. We know that the parietal cells don't only secrete or release hydrochloric acid, but they also produce intrinsic factor. Intrinsic factor binds with vitamin B12 and carries it into the intestines, where its final absorption place is going to be at that ileocecal region. In order for intrinsic factor in B12 to be properly absorbed, or for intrinsic factor in B12 to bind, we need an acidic environment. So now we know the negative implications of antacids. All right, food storage and optimizing digestion and preventing of food poisoning. So what this paragraph here is saying is that you can ingest something, and let's say I'm out and I'm out biking with my kids, and then like over the last summer we had seen some berries. So I pulled over and grabbed some berries from the tree. I smelt it first, smelt good, looked good, put it in my mouth, kind of waited for any tingle in my lips or on my tongue, looked for any clues that might tell me that, hey, this is maybe poisonous, and then swallowed it and waited a minute or two. And what ends up happening is, if those berries are good and they're healthy, the pyloric valve opens and it dumps those berries into the duodenum. However, if they're poisonous, then what's going to happen is that pyloric valve won't open as readily, and reverse peristalsis takes place, and I can throw up the poisonous berries. Okay. Also, keep in mind that there are certain things that are absorbed immediately from the stomach that don't need to go into the duodenum for absorption. So alcohol is absorbed directly through the lining of the stomach. Aspirin is absorbed directly from the stomach. Water can also be absorbed directly from the stomach. So what ends up happening is, as the person consumes alcohol, and their serum alcohol level approaches toxic levels, the innate intelligence of the body assumes that only a small amount of alcohol has been absorbed in the bloodstream through the small intestine, and the majority of the alcohol is still present in the stomach. And the body will then try to vomit the alcohol out, right? It'll try and throw it up and push it out of the body, even though the majority of it has been completely absorbed into the bloodstream. So that's when the person starts to vomit, and all they do is dry heave, and there's nothing coming out of the stomach anymore because it's already been absorbed into bloodstream from the stomach. Cancer of the stomach, again, just like any other cancer, it is an accelerated growth of normal epithelial. And some of the causes are going to be smoking, alcohol, gastroesophageal reflux disease, also known as GERD, spicy foods, pickled foods, salt-cured foods, fried foods, smoked foods, deficiency in vitamin A and zinc and molybdenum. Vitamin A and zinc are really needed for the regeneration and healthy growth of epithelium. And glutamine happens to be a really powerful amino acid to heal up any damaged epithelial lining. An unhealthy balance between good and bad bacteria in the stomach. You always want to keep those bacteria in check. The bacteria throughout the GI tract is referred to as the microbiome or microbiota. They used to be referred to as the microflora, but flora really isn't the appropriate terminology that we should be using. Symptoms of stomach cancer, when someone's talking about unintended weight loss, you see someone, you haven't seen them in a while, and you say, wow, it looks like you've lost a lot of weight. Are you dieting? Are you doing anything? They're like, no, I'm not doing anything. But yet they're losing 30 pounds in a month or 10 to 15 pounds in a 2-week period. That's an issue. Or they're walking through the supermarket and along the periphery or the walls, and they're seeing chicken and beef and animal products, and they have this aversion. It makes them very, very nauseous and sick just looking at it. Stomach pain, but also back pain, and hematemesis. Hematemesis is partially digested blood that comes through the vomit, and it looks like coffee grinds. That's hematemesis. And jaundice, which is yellowing of the skin, is jaundice. And if it's in a darker skinned individual in which you can't see the yellowing of the skin, you can easily see it in the white of the eyes. Okay. Typically, if there is stomach cancer, then they remove the gastrectomy. They'll actually remove the stomach with a chemo and radiation. A hiatal hernia is when you get this partial protrusion of the stomach through the weakening of the diaphragm. So what you're seeing in this illustration is that you can see the stomach is pushing through the diaphragmatic hiatus, which is the hole that allows the esophagus to penetrate through the diaphragm and lead into the stomach. But here the diaphragm is a little bit weaker, that muscle, and it allows a little bit of a protrusion of the stomach above. Now the problem with that happening is that the type of epithelium in the stomach is different than the epithelium in the esophagus. The pH of the stomach is different than the pH of the esophagus. So when you start to get the acidity splashing up, you start to get these esophageal ulcers, and the esophagus becomes really raw. So the symptoms are going to be GERD, gastroesophageal reflux disease with a hiatal hernia. Again, substernal pain, that heartburn or back pain, and dysphagia with a G. You want to put that G there, dysphagia, not dysphagia with an S. That involves speech. Dysphagia with a G is difficulty in swallowing. The causes, heavy lifting, obesity, pregnancy, tight-fitting clothes, and sometimes it's even congenital. So you want to be careful with obesity during pregnancy, or people that do lots of heavy lifting that have a weak core. This is sometimes why you'll see people wearing weight belts. They'll wear this tight weight belt if they're doing heavy deadlifts and heavy squatting to try and prevent that. And the therapies for hiatal hernias, do the things that are proactive, that are healthy, avoid the causes of cancer in the esophagus. If they have it, they'll invert the bed without pillows, kind of raise up the head portion so that the head is higher than the feet. Sleeping with high pillows just really makes it quite uncomfortable. Avoid the heavy lifting, avoid the tight clothing, work on body composition. When we say decrease weight, that's kind of like challenging for people. When you're just stepping on a scale and you're looking at a scale, you're just seeing a number. It's really not telling you the percentage of how much of that weight is lean mass versus fat mass versus water mass. So in terms of decreasing weight, it really should be focusing on increasing muscle mass, decreasing adipose or fat mass. With a hiatal hernia, decrease the size of the meals and just simply increase the number of meals. Stomach ulcers, these are primarily referred to as peptic ulcers, and they occur when there is an erosion or a breakdown of that protective mucosal lining of the esophagus, stomach, and or duodenum. Remember that the I'm having a blank for a second. It'll come to me. I'll get back to it. My brain is trained on one thing, and I'm trying to get into endocrinology to think of the one hormone that is responsible for making the mucus. I know I mentioned in the last video, so I'll come back to it. But in any manner, you want to be careful with things that actually inhibit or block the body's ability to produce mucus. Prostaglandins, that's the word I was thinking of. So aspirin inhibits the prostaglandins. Prostaglandins reduces fever, and prostaglandins also produce the mucus of the stomach. So if someone's taking aspirin or Tylenol or an NSAID to help with their pain or discomfort, it will block the mucus production, so that now you have more acid in the stomach in relationship to the mucosal protective barrier, and now the acidity eats through the lining of the stomach. And that becomes an issue. The causes of gastric ulcers, peptic ulcers, they occur when the secretion of HCl or hydrochloric acid and pepsin in the stomach are greater than the secretion of mucus. When that's the situation, then you're going to get an ulcer. So many factors can cause the increase of hydrochloric acid and pepsin, and that will damage that mucosal lining. Some of the factors that produce more hydrochloric acid and pepsin are going to be smoking, stress, alcohol consumption, caffeine, and even certain pharmaceuticals. So very, very careful. Now you look at the amount of people that are under stress, that are drinking coffee, that do smoke, and then they get this heartburn type of situation because they have that weak sphincter. So then they're using, and then whatever acids are in the stomach are splashing up, giving them the GERD. That's a major, major issue. And then they use the antacids, and that leads to a variety of issues because now they can't break down their protein. You got bacterial overgrowth, which can lead to ulcers, and you don't have the bactericidal effects anymore of the hydrochloric acid. They can't absorb B12. They can't break down their proteins, and it becomes a horrible cycle. The brain-gut connection, there's a separate and ancient neural system called the enteric neural system, and that kind of exists intrinsically throughout the gastrointestinal tract. The enteric neural system includes the submucosal plexus and the myenteric plexus. The neural system contains cells that are referred to as enterochromaffin cells, and these produce serotonin. When we think of serotonin, we're thinking a neurotransmitter that kind of affects your mood and how happy you are. The GI tract contains at least 7 different types of serotonin receptors, and when stimulated by serotonin, these receptors communicate with the nerves that control digestion and digestive enzyme secretions, and they're going to affect the GI motility. So if you have too much of that serotonin, it's going to increase the motility, and you can have IBS symptoms with diarrhea, or too little, you can have IBS symptoms, which is constipation. And that's what IBS, or irritable bowel syndrome, involves. It's this abnormal movement of having, increased bowel movements to constipated, the diarrhea to being constipated, the diarrhea being constipated. H. pylori or Heliobacter pylori. Now, there are some health professionals that believe that an infection with a type of bacteria known as H. pylori can cause an ulcer to occur. There are some recent studies that have concluded that the overgrowth of these bacteria in the stomach may only be the result of a hyperacidic environment in the stomach, which is caused by the ulcer, and that the presence of these bacteria in high concentrations is a symptom of the ulcer and not necessarily a cause, because the H. pylori produces a chemical substances that are similar to antibiotics, and they appear to protect the GI tract against other pathogens. Patients that experience pain is one of the most common symptoms of a gastric ulcer. The pain usually occurs when the patient's hungry and the stomach is empty. That's a key differentiating factor when we compare peptic ulcers to duodenal ulcers. So with a gastric ulcer or a stomach ulcer, the pain is usually when the patient is hungry and there's no food in the stomach, it's empty. The pain is sharp, it's a burning type of pain, and it's located in the abdomen and also the back. The ingestion of something bland sometimes relieves the pain of the stomach ulcer temporarily. Stomach ulcers, they are more severe than duodenal ulcers, and the patients usually experience more hematemesis, which is, remember, that vomiting of blood that looks like coffee grinds, gastroesophageal reflux disease, anorexia, and weight loss. This picture here just shows how the erosion can go through the different layers, where you have the mucosa, then it starts to break down through the muscularis and submucosa, and then the muscularis all the way into the serosa, and you have nerve endings that are located in these different layers, and that's what brings on the pain and discomfort. And you've got blood vessels there, so many times when they look at blood and they see an anemia, like the person's red blood cell count looks like it's out of range, or they look at iron levels. Iron levels are usually one of those things that tells the physician that, hey, they're losing blood somewhere. Why are they so anemic? Is there a bleeding ulcer somewhere? So usually iron levels or serum iron is a good indicator of some sort of hemorrhage or blood loss. Here you can see in this illustration where different locations where you can have these ulcers. You can see one up in the esophagus. You can see the gastric ulcer in the stomach. You can see a duodenal ulcer in the proximal part of the duodenum. Here's another picture and illustration of that. Here's another one. So the therapy for gastric ulcers: stress reduction. Avoid all the causes of cancer of the esophagus. Carrot juice, cabbage juice, raw cabbage juice contains a chemical substance known as substance U. The U was for the unknown, but they just knew that it was very helpful in healing ulcers. It's believed now that it's very high in glutamine, and glutamine is very helpful for the regeneration of damaged epithelium. Aloe vera juice is very calming and cooling to the stomach. Deglycerized licorice is also helpful. Just have to be careful with people that have high blood pressure with that deglycerized licorice. The duodenum, the beginning of the small intestine. When we look at the small intestine, it's a long tubular organ that's between the stomach and the large intestine. When we look at the small intestine, you're looking at it's approximately 20 feet long. Diameter is about 1.6. If we look at the three different sections of the stomach, duodenum, jejunum, and ileum, you can see by color the duodenum is that smallest part right there. Then we have the jejunum, and then we have the ileum. When we look at the duodenum, that's about 10 inches long. It's the closest to the stomach. It receives the chyme from the stomach. The jejunum is about 8.2 feet long. And then we have the ileum, which is a little bit larger than the jejunum. Look at the spelling of the word ileum there. It's different than the bone, the ileum, but it's almost 11.5 feet long. So the ileum is a little bit longer than the jejunum, and the ileum ends where it comes into contact with the portion of the large intestine called the cecum. And that valve between the ileum and the cecum is called the ileocecal valve. And that valve controls the flow of material from the ileum into the cecum of the large intestine. If it remains opened for a long period of time, then the individual has diarrhea, and if it stays closed, then there's constipation. Really important picture here because it shows, let's see if I can just get my pen here for you. So here, don't forget, we have the Plicae Circulares. We know what those are. That's these grooves that we see here that moves the food in a spiral direction so that it can mix whatever's in the inside to the outside and move whatever's to the outside to the inside. In this picture right here, it doesn't only show the villi that we see here on the tip. We could see the columnar epithelium, and then deep we can see that we've got the capillary network. We've got the arterial in here, we got the venule in here, and then we also have the green structure right in there. We can see the green structure, which is the lacteal, and the lacteal, which means lactation or milky, is used for the fatty things, so we can absorb vitamin A, D, E, K, and coenzyme Q10 within that network. So the Plicae Circulares, I explained what that is. It's these large spiral folds are located within the small intestine. It increases the functional surface area of the small intestine and causes the food to spiral and mix as it kind of moves through the intestines. It allows the mixing of the chyme to be more uniformly digested. Okay, good picture of the Plicae Circulares in there. Another good picture, especially on that left box. I mean, really good to kind of show the Plicae Circulares, all of those grooves. The villi, those are the small folds that are located in the Plicae Circulares, and that's really increases the surface area. I mean, that's where the absorption, the digestion and absorption of all those nutrients take place, are going to be within those villi. Another good picture of the villi, and then on the right-hand side, you can see the capillary network, you can see the lacteals, you can see the goblet cells. Those goblet cells are designed to make mucus. Okay. Another great picture of the villi. Another picture of the villi microscopically. Damaging those villi are a problem. So people that have celiacs, people that are consuming foods that they shouldn't, people who are on steroids or overuse of NSAIDs and many medications can damage the villi, so it affects the absorption of vital nutrients. When you're not absorbing the vital nutrients, that's where illness and sickness comes into play. The microvilli are just small microscopic villi, and they are located on the columnar epithelium. And those folds are designed not only to increase surface area, but allow for the absorption to take place. It increases it about 24 times. The functions of the small intestine, again, that's where the majority of digestion and absorption are going to take place, and it's where a lot of the intestinal juices are produced. There are Brunner's glands that are producing mucus. There are many enzymes that are produced there or that are secreted in there, especially through the pancreatic duct. Within the intestines, there's going to be intestinal carbohydrates that breaks down carbs, intestinal lipases for fats, and intestinal protease for proteins. And there will also be the pancreas that produces similar enzymes. They're just called pancreatic carbohydrates and pancreatic lipase and pancreatic protease. There's water within the intestines. There's plenty of electrolytes, and there's many hormones that are also secreted, like CCK, to help with the contraction of the gallbladder. Duodenal ulcer, a little bit different than stomach ulcer. Duodenal ulcers are about 4 times as common as gastric ulcers. And again, similar concept where you can have the hydrochloric acid burning through all those different layers, the 4 layers of the intestinal tract, and it becomes very painful because of the nerve endings. And this picture here on top also shows the blood vessels there. So now you can understand the terms of hemorrhages and bleeding as well. Really nice picture here showing the connection between the liver, the gallbladder, pancreas, and the intestines. So let's start with the gallbladder first. So we can see the gallbladder here in green. It looks like that pear. And then we have this beginning portion, that's the cystic duct. All right. Then we have the liver, and the liver has a right and left hepatic duct. So the right and left hepatic duct kind of join to form the common hepatic duct. Now the common hepatic duct and what's coming off of the gallbladder, the cystic duct, they join forces to form this, which is the common bile duct. Then you can see, if you follow that common bile duct, it's going to go right into that major duodenal papilla, and all of those contents are dumped into the beginning of the duodenum. Okay, and then we also have within the pancreas the main pancreatic duct. So you can see the main pancreatic duct here, and then it has one path going down the bottom way, and then another path going the top way. Either path that it takes, it'll end up dumping the pancreatic enzymes and sodium bicarbonate to try and buffer out the acidity into the stomach. All right, so now you can understand why the duodenum is such an important place of the small intestine for digestion, because you got the pancreas dumping contents in there, you got the gallbladder dumping contents in there, you got the liver dumping contents in there. Very important. So the gallbladder is dumping a lot of toxins and cholesterol and phospholipids into the duodenum. The liver makes the bile, the gallbladder stores the bile. The liver makes cholesterol, the gallbladder can store some cholesterol. So every time you have contraction of the gallbladder from the CCK of the intestines, it dumps that contents in the duodenum. And if the person doesn't have fiber in the diet to pull out the toxins and the cholesterol, then they're going to reabsorb it back into circulation. Okay, the liver is really important in detoxification. Very, very important for detox. There is phase 1. Let me see if I can change the color here. Pen color, we'll change it to blue. So there's phase 1 of liver detox, and then there is phase 2. And within phase 1, there's a lot of toxins that are coming in to the liver, and these toxins are endotoxins and exotoxins. Exotoxins are from the outside world coming in, and endotoxins are the byproducts of metabolism that are coming in. And many of these toxins that come in from pesticides and herbicides and medications, and then the metabolic byproducts are now coming into phase 1, and many of them are fat soluble. So phase 1 has to take these fat soluble toxins and bring them into phase 2 to make them water soluble. And in the interim of phase 1 into phase 2, there are so many reactive oxygen species that are produced, ROS, reactive oxygen species, or oxidants, or free radicals, or bullets going off in the body. And the only way to compensate and try and neutralize some of these reactive oxygen species is going to be with antioxidants. And that's why antioxidant and colorful foods are so very important to the diet, is to neutralize that. And it also explains why doing detoxes need to be done with doctor supervision and not because you watched a YouTube video on how to detox, because the process of detoxifying can be harmful and very harmful and more dangerous than the initial exposure to the original toxin. So you have the original toxins coming in, but then you have the damage from the reactive oxygen species. And if you're not equipped with the antioxidants to handle what's coming in or to handle the oxidative stress of the intermediary byproducts of what's happening between phase 1 and phase 2, you're in big trouble. So you want to have good support for phase 1, good support for the reactive oxygen species dietarily within the body, and then when the fat-soluble substances are converted into more water-soluble, phase 2 can then bring it to phase 3, which now it's water-soluble and you can get rid of it through the kidneys and through bowel movements, right? So from urination and defecation, you can remove. Now, it's best through urination if the pH of the urine is somewhere around 7.2, which is slightly alkalinic. You can remove as much of those toxins from the body as possible. Otherwise, what happens is you reabsorb. If the too acidic, the majority of people, when we check pH of the urine, most people I check are going to be somewhere around 5.5, which is on the acidic range in terms of pH. But if we can get the pH somewhere neutral or around 7.2, that seems to be the ideal pH to release and excrete the majority of the toxins through urination as possible. Otherwise, if you're not excreting it, guess what happens? It makes another pass through reabsorption back into phase 1. It's reabsorbed again. Then you got to go from phase 1 to phase 2, and guess what you're making more of? More reactive oxygen species, more oxidants, more bullets. And then again, if the pH of the urine is 5.5, guess what happens? Another pass back into phase 1. And then what happens between phase 1 and phase 2 is more reactive oxygen species. All right, so there's a little background into good detoxification. Okay, let's see. Symptoms of a duodenal ulcer. Here, the patient's going to experience some stomach pain and back pain, but here, it's often the pain is experienced after eating. Remember, with the stomach ulcers, it was before eating. With the duodenal ulcers, is after eating. And the pain is usually sharp and burning in nature and may sometimes be relieved by eating bland foods. The patients with duodenal ulcer can experience gastroesophageal reflux disease and often bloating. What are the causes? The pancreatic duct and the common bile duct, they both connect to the duodenum, as I showed you in that picture before. In addition to digestive enzymes, the pancreas is going to secrete the sodium bicarbonate. So the sodium bicarbonate here is alkaline or basic. The sodium bicarbonate from the pancreas and from the bile, from the gallbladder, help to neutralize the stomach acid. So that it prevents, ultimately it's designed to prevent a duodenal ulcer. Now, if the stomach is hyperacidic or the sodium bicarbonate in bile may be unable to neutralize that amount of acidity in the stomach, and then you end up with a duodenal ulcer. Okay? So the therapy, again, same as the gastric and peptic ulcer. Now, Crohn disease, sometimes known as regional enteritis or granulomatous colitis. It's an idiopathic inflammatory disorder. It can affect any part of the small and large intestine, but most commonly it's that ileocecal valve region. Most authorities believe the condition is caused by a combination of genetic factors and also immune factors. 10 to 20% of all the individuals do have a positive family history. Smoking can affect it and trigger it. Dietary substances can trigger it. And an unhealthy, there's that word, microbial flora. We don't want to use that word anymore. We want to call it a microbiota. So an unhealthy microbiome can also affect Crohn. And you can see the granulations, the granulomas that are forming in the lumen. The top is normal, the bottom is Crohn. Very, very inflammatory. A lot of these individuals with Crohn disease end up using these immunosuppressants so that the body doesn't attack itself. Otherwise, they have to do these resections to actually dissect and cut out the inflamed part of the intestine. But unless they remove many of the triggers, right? Just because you have a family history doesn't necessarily mean you're going to get it. There's always environmental triggers. That one looks a little bit worse, okay? So the most common region that you can see here in this picture is going to be that ileocecal region, but all areas can be affected, but this one down here, the ileocecal, is the most common site. The problem with that is, remember, what's absorbed here is B12. B12 is really needed for DNA synthesis and RNA synthesis, for myelin production of the neural system, for neurotransmitter production, for methylation to take place. Individuals that suffer from Crohn may show no other symptom other than IBS. Other symptoms can include diarrhea, weight loss, malabsorption of B12, B9, which is folic acid, vitamin D, abdominal pain, and blockages. So the immunomodulatory agents, immunosuppressants, there are many on the market today that are designed to block them. Sometimes they use Humira, some use Remicade, and their theories as to which one may be better and why. The large intestine that extends from the ileum to the anus, it's about maybe 5 feet, close to 5 feet, 3 inches wide. Again, it has different portions of the large intestine. There's the cecum, there's the colon, and when we talk about the colon, we have, let's say, here's the esophagus, here's the stomach, then we have a small intestine, and now after the small intestine, we're going to have the large intestine. So that's going to go from like ascending colon, transverse colon, descending colon, sigmoid colon, the swirl, then you have the the rectum, and then the anus, okay? The cecum, it means blind pouch. It's an expanded portion, and material passes from the ileum through the ileocecal valve into the cecum. And right off that cecum is the vermiform appendix. That's a slender, hollow appendage. I'm going to show that to you in a picture. It's part of the lymph system or immune system. When it becomes inflamed, we call it appendicitis. It's found in the lower right quadrant, halfway between the belly button and the ASIS, right between there. Then you have the ascending colon. There's the transverse colon, descending colon, and sigmoid colon. Easier to probably show you this in this picture illustration. Let me see if I can change the color here. Let's see if I can use, let's use green. So right here, there's the ileum. This section right there is the cecum. So you can see right there in the center the ileocecal valve. There's the vermiform appendix. Okay. Now we have ascending colon going up. Then we have transverse colon. And then we have descending colon. And there's the swirl. So here's the sigmoid colon. Then we have the rectum. And at the very end, we have the anus. Now look in the right and left corners. So here is the right colic flexure, and since the liver is on that side, it's also called the hepatic flexure. And on the other side, you have the left colic flexure. Since the spleen is on that side, it's called a splenic flexure. Okay, let's see what else we have here. The functions of the large intestine: it forms the feces, it stores the feces, and very small amounts of digestion actually take place there, right? Most of it is in the duodenum, but the only digestion that really takes place in the large intestine is pretty much by bacterial action, okay? And about 15% will take place there. Good bacteria, bad bacteria. It's really important to have more good bacteria than bad bacteria. Otherwise, you get this dysbiotic condition. And dysbiosis, those bad bacteria give off a lot of gas. You could smell it through the breath. The belly becomes very inflamed. Though those bacteria also create lots of inflammation that can cause heart disease. They can create inflammation throughout the body and take any inflammatory condition and make it worse. And I mean any inflammatory condition. The good bacteria produce vitamin B and vitamin K. We know vitamin K is made by the bacteria in the colon because think of what happens when a baby is born. There's a sterile environment, and vitamin K is needed for clotting. So since the baby hasn't eaten yet, there's no bacteria and there's no vitamin K, there's no ability to clot, usually they will inject babies with vitamin K to try and prevent any type of bleeding disorders that may be taking place from a traumatic type of birth. Dysbiosis is bacterial overgrowth. It can happen with Candida, it can happen with yeast. Typically halitosis, which means bad breath, is an indicator of dysbiosis. And Candida albicans, or yeast, primarily affects females. It can exhibit with a yeast infection, especially in the vaginal area, right, where there could be an itch, there could be rash, there could be a white, cheesy discharge, foul odor. All with yeast. You can also look at the tongue. When the person says and they stick out their tongue, you don't want to see any heavy white coating or thrush that involves the tongue. That can be seen with high carbohydrate diets, oral contraceptive use, antibiotic overuse, really, really bad, and high sugar or carbs in the diet. So the causes of Candida albicans infection, anything that's going to cause the growth of yeast cells to manifest, whether it's the refined carbs, the oral contraceptive, prolonged antibiotic use, beer, any beverage that has these residual yeast cells, clothing, certain clothing, pregnancy, anything that can compromise the immune system like acquired immune deficiency syndrome, anything that can lower the resistance. So the therapy is going to really look at the lifestyle of the individual and try and decrease whatever's promoting the yeast overgrowth. They actually have anti-Candida diets that are out there to manage this. So it's really an inside-out job. You have to address it from the inside, not from the outside. E. coli. There is a newer type of E. coli called E. coli 0157. It's been linked to severe illness, even death in people. So it typically occurs when they're processing cattle for meat, and when they butcher the animal and they cut the animal open, sometimes they actually slice the colon open, which means that they're going to have bacteria and feces that can be contaminated within the meat. So you get this fecal material in there. It's important to prevent the ingestion. You want to prevent the ingestion of those bacteria in all meats, and the way to do that is cooking the meat properly, and that's why eating meat rare or raw could be dangerous, because if there is bacteria on the meat that isn't killed by high heat, then you get this overgrowth. That's why having meat, let's say if someone's cooking a steak, the bacterial the E. coli danger is only on the top, bottom, and sides of the steak. Easy to kill that once it hits a flame. But when it's meat that is, let's say, ground beef, it could be on the inside, not on the outside, and the flame doesn't destroy the E. coli unless it's cooked well. If it's still raw and red on the inside, the potential for E. coli bacteria is very high. Now, E. coli can be spread not only with meat, but it can happen with vegetables because they're using manure as fertilizer. So that's why you have to wash your produce very, very well. Whether they're using chicken manure or they're using horse manure, to allow spinach to grow and lettuce to grow, you have to be very, very careful. Tomatoes, we all hear about these E. coli outbreaks, whether it's on romaine lettuce and whether it's tomatoes and vegetables. You have to be careful with hot dogs. So you're least likely to get it on a cut piece of steak, but very likely in a lot of the vegetables or a lot of the ground beef. You have to cook those things very, very well. Diarrhea versus constipation. We spoke about the ileocecal valve and its relevance. If it's open too long, it's diarrhea. If it's shut too long, you get constipation. Diarrhea can be a good thing, especially with food poisoning. It's a quick way of rapidly flushing out the debris and the poison from the body. Constipation is not good for a long period of time. You don't want to get that buildup of pressure. You want to be able to eliminate toxins. You want to eliminate to clear out cholesterol. So high cholesterol, one of the first questions I typically ask my patients is, when was your last bowel movement? Simply not moving the bowels enough can also increase cholesterol. I want you to take a look at this picture and see if you can figure out what's going on here. Let's see if I can change this. This right here is the belly. This is the male. It's not a female. This is not a pregnant woman. Here are the legs. Here is the chest. This belly is a toxic megacolon from dysbiosis. The bottom picture is showing the size of the colon. Tremendous. That's from bacterial overgrowth. That's why dysbiosis can kill. Diverticulosis or diverticuli, they're outpouchings of the large intestine from increased pressure, either from high-fat diets or low fiber. Fat is great to have in the diet. Don't be afraid of eating fat. If you don't have fat within your body, number one, how are you going to absorb vitamin A, D, E, and K? Now, we're not saying be morbidly obese. We're saying that fat is healthy and that having some unsaturated fat and saturated fat is okay. It really is. I wouldn't have trans fats, and I wouldn't have an abundance of saturated fat or an abundance of unsaturated, just the right amount. You need some omega-3s, you need some omega-6s, you need some omega-9s. You just don't want an abundance of omega-6 compared to omega-3s. Omega-6 is typically pro-inflammatory. Although there are some anti-inflammatory forms, the majority of them are very pro-inflammatory, whereas the omega-3s from your fish, these are anti-inflammatory. You can see the diverticulosis and diverticulitis. Diverticulosis is just the presence of diverticuli. The diverticulitis is the inflammation, and this could be very painful. I've had patients come in this year that have had major lower back pain, and I couldn't find anything wrong with their lower back. And as soon as we sent them for testing, they found the diverticuli. So they not only can have stomach cramps and stomach pain, but very commonly have musculoskeletal back pain. The problem with diverticuli is you can see that here you have these out pockets. You see here, here's an out pocket, and here's an out pocket. But you can also see blood vessels here. You can see them. So if you get fecal matter that's stored in here, and one of those blood vessels ruptures on the inside, fecal matter can spread into one of these vessels, and now you get septicemia. You can get the systemic spread of bacteria. Okay, so we spoke about the causes of diverticuli. I don't have to repeat them, but you can review it. They've typically said that avoid small foods like nuts, seeds, and grains that can fill in those areas. We know now that they're okay to consume those things as long as you're well hydrated. I wouldn't have them dry. If I'm having nuts and seeds and I'm consuming them, that's fiber. Right? Remember, the cause of diverticulitis is lack of fiber and too much fat. And then you get that pressure build up with bowel movements, and you blow out a wall of the intestine, like a blown out, like rubbing up against a curb with your tire, and you get that bubble on the outside wall. That's like a diverticulosis and diverticulitis. So if you're going to consume those things, it should be well hydrated. The pain can be very severe. There's also gas or flatulence associated with diverticulitis or diverticulosis. Increase the fiber, increase water intake, and fiber should be increased to like 35 to 40 grams a day easily. Colon cancer, again, abnormal growth of the epithelial lining of the colon, and you can see that the lumen, let me point this out to you here. You can see that the lumen is really small here. That lumen should be this size. but because the tumor growth is growing inward, it's making this very thin. So you can understand that it's going to be difficult to pass bowel, and if they do, the bowel comes out not a diameter like this, but it's going to come out in the diameter like this. They call it pencil-thin stool. Same causes of colon cancer are implicated with esophageal cancer and implicated with stomach cancer. You always want to also have good, healthy microbiome or microbiota. The symptoms of colon cancer: pain in the stomach, pain in the back, blockages, and pencil-thin stool. Colonoscopies are often done typically after the age of 40 to 45, and that's when they insert a camera through the anus. They go upward and they look for any polyps, they look for any damage in the lower part of the GI tract. The appendix, I showed it to you in that picture earlier. It comes off the appendix. You can see it there in that right lower quadrant, the vermiform appendix. That's one that's inflamed. And it protects the body against different types of GI cancer and infection. It stores some really good bacteria in there. Appendicitis is when there's pain that starts at the umbilicus, at the belly button, and travels to McBurney's point. McBurney's point is somewhere between the belly button and the anterior superior iliac spine, and there's pain with rebound tenderness, meaning you push your fingers in the belly and you quickly recoil and move it away, and they have lots of pain in that area, again from a high-fat, low-fiber diet. We went over the liver, gallbladder, and pancreas. The liver is involved in over 500 different chemical reactions that take place. I showed you the connection between the gallbladder and the pancreas and the duodenum, so you'll want to review them. But here's an isolated picture that really shows clearly the gallbladder, and then you can see the cystic duct. Here is the left and right hepatic ducts. They combine into the common hepatic duct, and then the common hepatic duct and the cystic duct come together to form the common bile duct, which is down in here. And now the common bile duct is going to open up into the duodenum at the major duodenal papilla. Here's the main pancreatic duct. Here's the accessory. Either path that those digestive enzymes take, it'll make it into the duodenum to help break down the food. The gallbladder is going to release those phospholipids, the cholesterol, the toxins, the calcium. You do not want stagnation of that. We know that the duodenum is going to release CCK, or cholecystokinin, to make the gallbladder contract, to release the bile and the phospholipids to emulsify and break down the fats. And we don't want the toxins and cholesterol accumulating in the duodenum. That's why fiber is so important. That's the sponge that releases it all. We know that the pancreas is an endocrine gland. It also, the beta cells produce insulin, the alpha cells produce glucagon, and then the acinar cells produce all of the digestive enzymes, including the sodium bicarbonate. The liver, we know, produces the bile. It's involved with detox. I went over phase 1 and phase 2 detoxification. It's involved in storing some vitamins. It's involved in the red blood cell breakdown, and the liver produces cholesterol. It's involved with your immune system. Cholesterol is produced by the liver primarily at night, and that's why when those are taking cholesterol drugs, they should be taken at night, not in the morning, because the liver produces it at night. In terms of the liver cirrhosis is an irreversible inflammatory disease of the liver by fatty infiltration. There is something that's pretty big these days that's referred to as non-alcoholic fatty liver disease. They typically will see fatty cysts. This is non-alcoholic fatty liver disease because there's alcoholic as well. Non-alcoholic can happen in actually pretty healthy people that have high fructose in their diet. Their triglyceride count will be really high. They're eating tons of fruit, and all of a sudden they get that buildup of these fatty cysts. Non-alcoholic fatty liver disease, NAFLD. Cirrhosis of the liver, when there is liver disease, you'll see jaundice, which is yellowing of the skin or yellowing of the white of the eyes. Also anorexia, nausea, weight loss. Hepatomegaly, this is when they're going to have stomach pain in that upper left, in the upper right quadrant. Hepatomegaly is enlargement of the liver. There could be swelling and edema of the legs. And of course, on blood, there are liver enzymes. When you look at blood, we have ALT and there is AST. So it's important to kind of look at some of these enzymes to pick up if there's any kidney or liver disease. Hepatitis. Hepatitis, typically you'll see on the news when real commonly you'll see, like in a restaurant, there could be hepatitis B outbreak or hepatitis A outbreak where a person went to the bathroom, didn't wash their hands properly, and then they're touching your food. You're going to have the hepatitis A. Hepatitis B and hepatitis C are typically spread from blood to fluids. A lot of people were developing hepatitis C through poor tattooing techniques and using tattoo parlors that really weren't following the law. I wouldn't worry about the symptoms of hepatitis. We can skip through that. In terms of digestion, there is the sympathetics and parasympathetics, and we know that the parasympathetics speed up digestion, sympathetics slow it down. Sympathetics is typically the accelerator, it's the thoracolumbar outflow, whereas the parasympathetic is the craniosacral outflow. Craniosacral because it's cranial nerve 3, 7, 9, and 10, 10 being the vagus nerve, which controls about 90% of the parasympathetics, including digestion. There's lots of connections now between that vagal nerve from the stomach and the brain with depression and anxiety. And when there's abnormal growth of bacteria from the stomach, they use the nerves as the pathway to get up into the brain and throws the emotional state off. That's why I say, what is the food after the mood? How do you feel after the meal? Sympathetics is fight or flight response. Parasympathetic is feed and breed. In terms of the biliary system, I want you to just review how the biliary system works. So here's the gallbladder. And what I want to show you is that within the gallbladder, there's water, phospholipids, bile acids, cholesterol, and toxins. Phospholipids and bile salts and water are the emulsifiers. They're breaking down fat. And cholesterol and toxins we want excreted through the system after it's contracted from the gallbladder and the duodenum. We want water and we want fiber to pull them out. That's why healthy bowel movements are really important. So what's happening here is the phospholipids, if you look here, you remember the phospholipids, you have the phosphate portion, and then we have the lipid portion, and the lipid injects itself into the fat, and now you have this hydrophilic portion on the outside. All of this is hydrophilic. It likes water. So the fat is now disguised as water, and the body has found a way to eliminate it. Okay? If the gallbladder isn't working, you're not going to have stool that sinks. You're going to have stool that actually floats. So you want to be able to just pause this and read through that section. Detoxification, we spoke about phase 1 and phase 2 liver detox. The liver does a great job at trying to convert all the toxins into something useful. Even alcohol, it can break down into glycerol, fat, and sugar and try and use some of it constructively. If there is a toxin that's broken down, it will put it into the gallbladder, and the bile and the toxin will eventually be excreted from the body through the feces, and that's why fiber is so very important. It kind of prevents the reabsorption of the toxins and cholesterol back into systemic circulation and excretes it from the body. When you have stagnation, when the CCK isn't released and you have stagnation within the gallbladder, you get these gallstones called lithiasis. Cholelithiasis is an accumulation of the cholesterol and the calcium and phospholipids, they just accumulate and they can form stones like this. And that becomes very painful if you eat fat and it tries to push one of those stones through the cystic duct. Ouch. Pain is usually behind that right scapula. They get nausea, cramping pain. Typical, and you can see them here, those white structures that are circular. That's the body trying to push them out. You can see them here as well. Those are gallstones that are trapped and stuck in the cystic duct. Remember, the only thing that should be seen on an x-ray is going to be anything that's calcified, and that's what those gallstones are, a combination of calcium. Symptoms are after a pain after a fatty meal, typically behind that right scapula. And there's going to be jaundice as well. Typically seen in the 4 F's in female, fat, 40. Let's try that again. Female, fat, fertile, and 40. That's the 4 F's that typically refer to, and also fair-skinned. So fair-skinned females that are fat, fertile, and 40 typically get gallstones. When there are gallstones or gallbladder issues, or the gallbladder is removed, we will typically see challenges and complications with thyroid function in conjunction. That's because if they're not breaking down fat properly, they can't put the fat in the receptor on the thyroid. And thyroid stimulating hormone is a fat-soluble hormone. If there's no fat on the receptor because there's no gallbladder and you're not breaking down the fats to put it in the receptor, then we have a problem. Okay, so here they'll try and do lithotripsy. They'll use this ultrasonic pulverization to try and break down those gallstones so that it's not painful removing it. Otherwise, they do a cholecystectomy to remove the gallbladder. If there is a cholecystectomy, decrease the fat in the diet, supplement with lecithin and other digestive enzymes. You want to increase the number of meals, but decrease the size of them. The pancreas, we said, is a mixed gland. It's endocrine and exocrine. We know that it produces glucagon and insulin from the beta cells of islets of Langerhans, glucagon from the alpha cells, and the acinar cells are making all of the digestive enzymes. Sodium bicarbonate is the digestive enzyme that's alkaline. That, along with the gallbladder, neutralizes the acidity of the contents that are being dumped from the stomach into the duodenum. Pancreatic issues and pancreatic cancer is a painful type of cancer. It's because it's held very, very tightly in that peritoneum, so it can become very painful. Most patients with pancreatic cancer, they're jaundiced, they're yellow, they have stomach pain, there's major weight loss, and 90% of the patients, the tumor is already metastasized by the time that it is discovered. Okay?